Hello and welcome to our YouTube channel. If you haven't subscribed our channel, kindly please subscribe our channel. So this 30-year female patient presented to me with history of uterus pain, heavy menstrual bleeding and infertility. So let's do ultrasound of this patient. So you can see that I have opened the uterus in longitudinal axis. You can see a globular shaped structure. You can see here the white lining of the uterus. Here I am opening the uterus again in longitudinal and transverse section for you. You can see the uterus in transverse section right now, and now you can see in longitudinal section. You can see a few heterogeneous areas in the anterior wall of the uterus with Venetian artifact and some anechoic spaces. So this is mostly a case of anterior wall fibroid. You can again see the uterus in transverse section with Venetian artifacts. So whenever you see a Venetian artifact, think about two findings. Either it's a fibroid or it's adenomyosis. So I have marked the fibroid for you with the red arrow and the normal uterus with white and cervix. So ultrasound findings are a heterogeneous area of 3 into 2 centimeter is seen in the anterior wall of the uterus with Venetian curtain shadows. Features are suggestive of anterior wall intraovular fibroid pushing endometrium posteriorly. So what are fibroids? Fibroids are non-cancerous growth of muscles and tissues of the uterus. They are very common in females. So types of fibroids are three types: subserosal along the surface of the uterus, outer surface submucal along the endometrium, and intramural in the uterus myometrium. So here I have explained the types with a sketch. You can see number one type is subserosal type. It is found along the outer layer of the uterus. Number two, submucosal, green in color. It is found along the endometrium of the uterus. And number three, and the most common one, is intramural fibroid, that is highlighted by yellow color. So whenever a fibroid grows inside, it will push endometrium either anteriorly or posteriorly. If fibroid is of anterior type, it will push endometrium posteriorly, and if it is posterior, it will push endometrium anteriorly. And there is another type of fibroid which is found in the lower portion of the uterus, highlighted by pink color, that is cervical fibroids. Cervical fibroids are not much common, but they are very painful fibroids. So this is all about the fibroid. If you like our topic, kindly give suggestions and do follow and subscribe our YouTube channel. Till next video, take care.